Well, you're hearing it everywhere. Get your flu shot.
It's always been important, but doctors say it's more important than ever this year as they worry that the flu and COVID-19 could quickly fill up hospital beds.
UW Health and News 3 Now are teaming up to show you that even doctors and chief meteorologists get flu shots. Yesterday, we met in the News 3 Now garage to witness Dr. Jeff Pothoff and chief meteorologist Gary Canalte get their flu shots. Take a look.
This year is extra special because we have this COVID-19 pandemic going on. One of the things we worry about as healthcare professionals is that if we have a really bad flu season and influenza season on top of a COVID-19 pandemic, that could put us in a tough spot. We might run out of personal protective equipment. We could have hospitals that are overrun with people with respiratory disease. And what we don't want to see is people who get both at the same time. So COVID-19 and influenza, we think those people are going to do a little bit worse than people who would just get one or the other.
Will the flu shot protect you in any way from COVID-19? Are they connected at all?
Right, so the flu shot won't protect you from COVID, except in the sense of it'll protect you from getting both COVID and influenza at the same time, which would be really tough. That would be a hard thing to kind of beat yourself if you got both at the same time. So that's where the flu shot can help you as it relates to COVID.
And everyone should get one.
Yeah, I think, there's a lot of kind of urban legends around influenza shots. You'll hear someone say, I got the flu shot and then I got the flu like the next day. And these one-off stories, they sound good, but for the most part, if you get the flu the day after the flu shot, that means you were exposed to influenza before you got the shot. Some people say, I got the flu shot, it didn't work very good. And it's true that that flu virus can mutate a little bit between when the companies make the vaccine and the virus gets to us. But even those people who get flu get a much more mild case usually if they had already gotten the flu shot. So, unless you've got a strong reason not to get it, you're allergic to some part of the vaccine, or your doctors tell you you're not a good candidate, the influenza vaccine is really important for us to get this year.
If you get it now, will you be protected throughout the entirety of the cold and flu season?
Yeah, so the flu shot won't change. The one that we have now is the one that you'll get today, or you'd get 2 months from now if you waited. I think the reason to get it right now is one, we'll start seeing influenza pretty soon. Two, we expect there to be a big demand for influenza shots this year. So if you can get it now, best to get it now rather than think you're going to get it later and then have trouble with supply chain.
And it's going to last through the summer. I mean, it's not going to wear out in February.
No, there's one flu shot for the year. So if you get it now, you're good for the rest of the respiratory season. You won't need another one until next year.
Should you have your children vaccinated?
Yeah, it's very important that our children get vaccinated. I think lots of times we don't think of them as having bad outcomes from influenza or the cold, but there are a number of children who do have really severe cases of influenza. Really important to get your kids vaccinated this year too.
So get your shots.
Thank you, Dr. Pothoff. Gary is so brave. He does it for us every year.